Hello, this is Dr. Yael Halaas. I am double board certified facial plastic and reconstructive surgeon. And today we're going to go over the most frequently asked questions for my most frequently performed procedure, blepharoplasty, also known as eyelid surgery. What is blepharoplasty? Blepharoplasty is surgery of the upper or lower eyelid and is actually one of the most common procedures performed on patients by plastic surgeons. The eyes frequently show the first signs of aging, whether it's crow's feet, whether it's hooding because of extra upper eyelid skin, or bags below the eyes are the telltale sign. And indeed, many patients turn to surgery as a solution. Am I a good candidate for blepharoplasty? So for upper eyelids, a good candidate would have extra eyelid skin or heaviness of the upper eyelid. I often tell female patients that when you're applying your upper eyelid eyeliner, and if it starts rubbing off onto your upper eyelid skin, that's actually a telltale sign that you would be a good candidate for upper eyelid surgery. For lower eyelids, an ideal candidate is someone who has a little bit of extra skin underneath that lower eyelid, but also what we're really addressing, which is puffy eye fat bags. Whether it's upper or lower eyelid surgery, to be a good candidate, you should be in healthy, stable condition. And please let our office know if there's any medications, vitamins, over-the-counter drugs that you're taking. They all can influence your recovery. What is the difference between upper and lower blepharoplasty? Well, for upper eyelid surgery, what we're addressing is the heavy upper eyelid skin that can droop over, cause a weight onto that upper eyelid, and make it really difficult to keep your eyes looking open, looking awake, and to wear eyelid makeup. Lower eyelid surgery is addressing those puffy eye fat bags that really make us look like we have a really tired, sad, even angry appearance to the eyes. Also with lower eyelid surgery, you can be addressing a little bit of that extra skin that we have. Regardless of its upper or lower eyelid surgery, it's incredibly important that you have a good discussion with your surgeon going over your expectations and what your aesthetic goals and desires are. Frequently with my patients, I'll ask to see photos, maybe from 20 years ago, maybe when they were in their teens, a time when they really loved how their eyes looked. Occasionally, it's been a problem that's been around for a long time, and we're creating a new look. It's so important that the surgeon is tailoring the procedure for you and really understands your needs. Good communication is key. Will blepharoplasty affect my vision? That's a very important question. And of course, we want it to improve and help your vision in a positive way. What do I mean by that? Well, if we have a lot of heavy upper eyelid skin, our field of vision actually can become limited because of that heavy skin hanging over the lateral vision of our view. When we remove that, we can actually have the eyes more open and feel like more light is coming through and that we have more peripheral lateral vision. It's incredibly important that your surgeon takes great care when performing the surgery. How long does the surgery take? Whether it's upper eyelid or lower eyelid surgery, the procedure usually takes about 1 hour. Upper eyelid surgery can be performed greater than 90% of the time, actually, in my practice, under local anesthesia. Lower eyelid surgery also takes approximately 1 hour of time. But in this instance, often patients prefer to have a little bit of twilight or IV sedation. When I'm performing upper and lower eyelids together, the procedure usually takes just under 2 hours. What type of anesthesia is used during blepharoplasty? Blepharoplasty, whether upper or lower, can be performed under local anesthesia, meaning simple injections of local anesthetic so that you are essentially awake but not feeling the procedure. Upper eyelid surgery is frequently performed under local anesthesia. Lower eyelid surgery is more frequently performed with a little bit of what we call twilight, also known as IV sedation. So you're just lightly sleeping, similar to a colonoscopy, and really don't have any discomfort or really remember the procedure either. Both procedures can be performed either under local or IV, also known as twilight sedation. Either way, we will work to make sure that you are comfortable All of our anesthesiologists are board certified and work closely together with the surgical team to make sure that your experience is the best possible. Will I have visible scars after the surgery? That's a great question. Let's go over for upper eyelid surgery where we make that incision. The upper eyelid incision has sutures which are generally removed roughly about 5 days after surgery. With time, that incision will fade away. I often say that at 1 year, you'd be hard-pressed to actually find where it is. For lower eyelid surgery, the incision can run very closely hugging underneath the lash line, or more commonly, there is no incision, and I have an incision actually hidden on the inside to go and address that fat directly. What is the recovery process like? Well, I'm happy to report that almost all patients report a painless recovery, and that's really the ideal. Although we will be giving you prescriptions for nausea, for sleep, for pain, antibiotics, ideally, just an extra strength Tylenol would be all that you need to take. Are you allowed to exercise during this period? You are not. You must refrain for 3 weeks from doing any heavy lifting, that's anything over 15 pounds, or any strenuous activity that would get that heart rate or your blood pressure up. There will be some swelling, particularly during the first couple of days. That's the important period, those first 3 days when you should be icing to minimize the amount of swelling. But really, once that first week passes, there's a tremendous reduction in that swelling, and patients are actually starting to look pretty good. Usually a day or two after their sutures are removed, you can actually put on makeup and concealer and really start to resume your public life. When can I return to work and normal activities? Well, it depends on what type of work you do. Heavy lifting and strenuous activity is not allowed for 3 weeks. In addition, because the eyelids are recovering and have some swelling, during that first week, I need you to abstain from long periods of computer work or staring at our handheld devices. Unfortunately, when we use these devices, we don't blink as much, and that can actually put a lot of strain and give a lot of dryness to the eyes. I recommend having a humidifier by the bedside, and we should all have humidifiers by our computer screens. You can absolutely read and watch TV during that first week, but you really do need to be taking it easy. Can you have a meeting and speak to others? You absolutely can. Your brain is perfectly functioning. But I think you should plan on the first 3 days just being dedicated to icing and relaxing. And again, no strenuous activity. And really, give your eyes a rest. Watch TV, even reading a book. Just no handheld or computer devices. How long do the results of blepharoplasty last? Well, for upper eyelids, I've seen patients last more than a dozen years because it takes a long period of time to develop that extra upper eyelid skin. So it really can be decades until you have that amount again. For lower eyelids, some great news. Once you remove that puffy fat, you can gain 20 pounds, you can lose 20 pounds. That puffy eye fat bags, they do not change with weight loss or weight gain. Once that fat has been removed, it doesn't come back, it's not replicated. There's some really good news there because often lower eyelid surgery can really last for decades. Are there non-surgical alternatives to blepharoplasty? Let's do a deep dive to really understand what the issue is that you might be complaining about. As we discussed earlier, upper eyelids help to get rid of the hooding and heaviness we have above the eye. Lower eyelid surgery is dealing with the fat bags underneath and also some redundant skin. But if your complaint is crow's feet, those smile lines, then I would recommend Botox. If your issue is that when you smile, you have a big, puffy, almost, we call it a jelly roll underneath the eye, Botox can help with that also. If the problem is just creepy skin around the eye, laser resurfacing can be a great alternative. And if it's mild, something like radiofrequency could be a great choice. If you're not ready for surgery, for lower eyelids, I have another option for you. The M-Face eye applicators can actually be a no downtime, completely comfortable treatment that can strengthen the eye muscle and hold back that eye fat so that you can have that smoother appearance and have a more refreshed eye without surgery. What can I do to ensure a smooth recovery? First, second, and third are going to be follow your pre-op and post-operative instructions. 2, keep your head elevated, ice. And 3, ask any questions. Feel free to call really at any time. We want you to have the smoothest recovery. We want you to have a great result. Will my eyes look bigger after blepharoplasty? Well, heavy upper eyelids can make the eyes appear smaller because there's just so much hooding. When we alleviate that hooding, the eyes will look bigger and brighter. For lower eyelids, sometimes big puffy bags can draw away from the beauty of the eye. And once we have a smoother appearance below, we can have more attention to our beautiful eyes, and people may comment just how beautiful and lovely they are. Can blepharoplasty be combined with other procedures? That's a brilliant question. And whenever we're evaluating the eyes, we do need to look above and below to make sure we're really addressing the issue at hand. So for instance, very frequently, blepharoplasty is combined with a brow lift because as we age, the brows descend, and a heavy brow can contribute to hooding of the upper eyelid and also make us look angry and tired. It's a great combination to do upper blepharoplasty or lower blepharoplasty with a brow lift. They go together. Similarly, looking below the eye, if we have puffy eye fat bags, often we'll have hollowness and descent of our cheek, making our cheeks look less full at the same time due to gravity and the aging process. So a great combination can be a fat transfer. That's when we take fat from one part of the body, often the belly, thighs, and we harvest that fat and use it to fill in any unwanted contours, dents, hollowness that we may have below the eye that's also taking away from the appearance of the eye and making us look aged or tired. A third really great procedure to combine with blepharoplasty is laser. Many times people are complaining about crepey skin changes around the eyes. This is not going to be addressed by surgery. We are not doing surgery to pull the skin really tight with tension on our incision lines, with gravity pulling down. But what we can do is we can use a laser to essentially iron out the skin. So whatever surgical procedure we're doing is going to be enhanced by newer, more collagen, more elastin, essentially fabric for the skin around the eye. Is blepharoplasty covered by insurance? Usually, the answer is no. If there is significant peripheral field of vision loss, then the insurance may possibly cover. But it's important to understand that insurance does not cover cosmetic elective procedures. So although a surgery can be performed to remove just enough skin so that you don't have that peripheral vision field loss, most likely you want to have a cosmetically pleasing, natural result for the whole eye, in which case insurance is not going to cover that, and particularly not cover that then for the lower eyelid. How should I prepare for blepharoplasty surgery? Well, the first thing is, of course, having a consultation with your trusted facial plastic surgeon who's board certified. The second thing I would also do is to check in with my doctors, my general medical doctor, just to make sure everything is healthy and everything is going well, but also the eye doctor. It is important to get an annual ophthalmologic exam to check for dry eye, but also glaucoma, eye pressure, everything that your eye doctor will ensure to make sure that your eyeball itself is doing well. With your preoperative instructions, you're also going to see a whole list of medications that you should be avoiding. You might want to peruse your vitamins, your supplements, and medications you're taking to see which ones are blood thinners. Things like aspirin, Excedrin, naproxen, vitamin E, chia seeds, all can contribute to thinning of the blood, which would increase the likelihood that you could have bleeding during the surgery, leading to unwanted swelling or bruising. How many times can I have blepharoplasty performed? Ideally, the procedure is done maybe once or twice during a lifetime. Of course, sometimes small little revisions do need to be performed, and there really is no issue with that as long as there's no medical contraindication. And so that is the most frequently asked questions for blepharoplasty, also known as eyelid surgery. If you have any questions, feel free to reach out to me and, of course, my caring and concerned office staff.